Hey everybody, thanks for coming. If you could take a moment and please silence your cell phones, I would really appreciate it. Just put them on silent or vibrate or something. Thank you. Hi, I'm Lindy Olson. I'm one of the founding members of Indivisible Sherman, and I'd like to welcome you here this evening on behalf of Indivisible and the Grayson County Democrats. We are here tonight to listen to you. Congressman Radcliffe, Representative Phillips, and State Senator Estes were all invited to be here this evening via phone calls, emails, and faxes. They have chosen not to come or send any representatives, but we want to hear what you have to say. We will try to get to as many questions as we can this evening, but know that if we don't ask your question will still be sent to Radcliffe. That's why we had you do it on a postcard. We're going to mail those in the morning. As we have seen in recent months, our democratic institutions will only survive as long as there are people who are willing to uphold them. And we believe that town halls are one of the oldest and most important of those institutions. Before we get started here tonight, I'd like to thank a few people. Jane Ann Epperly and Barbara Spear did a lot of research in preparation for this. Jan Fletcher booked the venue and did the logistics and helped us with the sound. Dan and his people are filming, and we thank them for coming this evening. And our spokespeople are Glenn Johnstone and Lander Bethel. Right now I'm going to hand everything over to Jane Ann. She is our moderator, and she's going to explain the process for this evening. Thank you.
I guess I better silence my cell phone. I'm Jane Ann Epperly, and I'm a member of the Action Committee of the Grayson County Democrats, and I'm going to be your moderator for the evening. We really appreciate you coming out on behalf of all the organizations that have worked together to put this on for you tonight. What we have is a program in two parts. We're going to have a question and answer session where we have these two representatives up here, each with a different point of view. You're going to have the opportunity to ask questions on current issues. Then we're going to have a presentation from Lander Bethel, the former chairman of the Grayson County Democrats. He took a 3-hour plane ride right next to John Radcliffe from Washington, D.C. to Dallas. It was a fascinating conversation, and he's going to tell us a little bit about it after our question and answer session. Okay, and then Jan Fletcher, who is the chair of the Action Committee, who has done so much to pull this evening together tonight, will do some closing remarks. And I really appreciate you bearing with my thick Texas accent. That's probably not the best thing for a moderator, but Trump is not the best president for our nation, so you can't ever get what you want. And if you can't understand me, grab a redneck, they'll translate for you. It'll be okay. Okay, I would like to start tonight by reading a quote for you. This is from a March 27th, 2014 press release. Then candidate for Texas 4th Congressional District, John Radcliffe, announced the following. Many elected officials are not accountable, and I want to be. I believe that town hall meetings offer an opportunity for constituents to ask tough questions of their elected officials in a public setting. I will do them regularly if elected. Radcliffe pledged to hold a minimum of 6 town hall meetings a year if elected in district. Now, that's a campaign promise that remains unfulfilled. Mr. Radcliffe isn't here tonight, but what we do have is a forum to come together and discuss issues of common concern. We have 2 spokespeople here tonight, each offering a different perspective. Lander Bethel, the former chair of the Grayson County Democrats, will bring you the progressive Democratic point of view. And then we have Mr. Glenn Johnstone, who's going to stand in as our Republican representative tonight. Now, I will let you in a little secret. Mr. Johnstone is also a Democrat, so the responses that he is going to give to the questions tonight come from a collection of publicly stated positions from Mr. Radcliffe. We have combed through press releases, social media posts, videos, personal interviews, and letters to constituents back and forth to try to compile a good group of responses for you guys to the questions that we're going to have here tonight. Now, in the event that we can't get to all your questions, as Lindy said, they're all going to be collected, and tomorrow they'll be mailed to Mr. Radcliffe's Washington, D.C. office. because it's so important that your voice is heard and that your opinion's counted. So even if you don't want to stand up tonight and read your question, just please put something on a postcard to send to him tomorrow so that we can have as many as possible hitting the mail tomorrow and getting it to his office in one big bag. We would really appreciate that. Okay, now what I'm going to do, the way that we're going to do this tonight, we're going to ask the people to come forward and read their question to the panelists. And then each gentleman will have an opportunity to respond. We are going to let, in this instance, we are going to let Mr. Johnstone, he will give the first response. Okay, and if I can have Sherry Scott, MD, would you mind coming up to read your question to the panel? Yes, up here. You can stand right there and absolutely. And here's your question.
Across Texas, 15 rural hospitals have closed since 2013. Officials worry that more of the state's 163 rural hospitals could close if they face more cuts to Medicaid and Medicare. In 2016, a study done by the University of Texas System and University of Texas Health Northeast was published and released. It deemed 35 counties making up Northeast Texas if a state would rank among the least healthiest to live in. Mortality rates in ages 25 to 34-year-old adults rank 49% higher than Texas overall. In age groups 35 to 44 rank 57% overall in the state of Texas. Dr. David Lakey of the study said, Northeast Texas, an area that faces some of the most significant health challenges and disparities in the state. In my community, Paris, Texas, Lamar County is deemed an underserved area for women's health and is served by Medicaid funding through Planned Parenthood that serves 250 to 400 clients monthly. Our only pediatric clinic is dependent on Medicaid reimbursement that fluxes somewhere around 60% of its patients' population. Having this data available to you, a U.S. representative pledged to serve this district, you voted gleefully for the U.S. House healthcare replacement version that is deemed meaner than the current Senate version, woefully unpopular. Knowing how adversely it would affect your district, how could you do it?
Now we'll have a response from Mr. Johnstone.
This reply is from a source from 05/07/2017, the Radcliffe report. I was proud to uphold my commitment to repeal and replace Obamacare by voting for the American Health Care Act, which passed the U.S. House of Representatives. The legislation is in direct response to the overwhelming majority of folks in my district who support Mr. Trump, President Trump, from a firm commitment to work with the Republican Congress to eliminate Obama health care once and for all. And according to a new report in Texas, it is experiencing a stunning 82% increase in Obamacare premiums since 2013. So rather than being able to use their paychecks to put food on the table, save for their children's education, or plan for their retirement, families across Texas and across the country are being forced to funnel more and more of their hard-earned dollars into the failing disaster of Obamacare. This is why I was proud to vote to repeal Obamacare and put conservative health care reform in its place. I refuse to sit by idly and watch it crumble under its own weight while punishing far too many hardworking families on its way down. The folks I represent in the Texas 4th District deserve better, and the American people deserve better.
Now we're going to hear from Mr. Bethel with the Democratic response.
Well, thank you. And Sherry, thank you very much for your question. It's amazing to see and hear how much our Texas legislators have turned down assistance from the federal government for healthcare. Our Texas representatives, our Texas legislators in the House and the Senate turned down $17.4 billion in Medicaid expansion just to be able to say no to Obamacare, just to be able to say no to the Affordable Care Act. That to me is a travesty. I think we're going to see more rural hospitals and small hospitals close. We have hospitals within Grayson County as well that are more and more on the margins because they do not have the Medicaid expansion that could have been available. One of the things that Representative Radcliffe has talked about is the good way in which he's going to help healthcare